Thank you. Good evening to you all, and welcome to a virtual meeting of the Social Care, Housing and Public Health Policy Overview Committee. This virtual meeting is also being broadcast simultaneously on the Council's YouTube channel, Hillingdon, London. I'm Councillor Philip Corthorne, and I am the chairman of this meeting. Just one or two bits of online housekeeping. Before we start, some important online housekeeping events for everyone present. Please ensure any mobile phones around you are on silent. If you're wearing a headset, ensure microphone is away from your mouth to avoid noise when not speaking. Please keep your microphone muted when you're not speaking and then unmute to speak. Only one person may speak at a time, and I, as chairman, will call those people to speak. We now move on to an attendance roll call. Before we move on to the agenda, I'll do a roll call of all the councillors present to confirm attendance. Please indicate you are present when I say your name. Councillor McQuarna.
Good evening, I'm present.
Good evening, thank you. Councillor Cooper, we're still having some difficulty with, are we? Okay, well, I'll move on for now. Hopefully we'll see you soon. Councillor DeVille.
I'm here, good evening.
Good evening. Councillor Eggington.
Good evening, I'm here as well.
Good evening. Councillor Gardner.
I'm here.
Evening. Councillor Haggard.
Good evening, present, Chair.
Okay, good evening. Councillor Rodriguez.
Oh, sorry, good evening, I'm here.
Good evening. And finally, Councillor Tuckwell.
Good evening, Mr. Chairman, I'm present.
Good evening. And then also, please can the officers present indicate they are in the meeting. Kate Kelly Talbot.
I'm present, good evening.
Evening, Kate. Copy ready?
Good evening, I'm present.
Dominica Kalik.
Good evening, I'm present.
Okay. Is someone trying to come in? Is that Tony Zaman coming in?
Tony Zaman is here. Yep, thank you, Councillor Corthorne.
Okay, noted. Thank you very much. Not on my list, but good to see you. Gemma McNamara, please.
Good evening, I'm present.
Okay. Rod Smith.
Yes, hello, I'm present.
Evening, Rod. Melissa Murphy.
Good evening, I'm present.
Evening, Melissa. And finally, Liz Penny.
Present, Chairman.
And Steve Clark.
Present, Chairman.
Thank you very much indeed. Moving on, in terms of technical meeting control, if any councillor leaves the virtual meeting partway through for a period of time, for example, with a lost connection, I will continue the meeting unless we are not quorate, which in this case is 3 councillors. Before we go on to the business of the evening, I just want to give one or two personal reflections on coming to this committee. I seem to have acquired a bit of a habit of succeeding newly elected council leaders into their former roles. Councillor Gardner may remember that back in 2000, I succeeded Ray Puddivat on the Youth and Leisure Committee, and now here I am following Councillor Edwards. I was clear all along that I wanted a new role outside of Cabinet, and I'm delighted to be here. In some ways, it's a bit of a homecoming, as a lot of the subject matter, not all of it, but a lot, covers areas for which I had Cabinet responsibility. I have always spoken highly of the work carried out by this POC in particular, and how it complements a Cabinet decision making. Now, I've got a bit to learn, certainly, but I already sense there are going to be some opportunities to improve the way we work, to enhance the very significant contribution this committee already makes, which I think is in everyone's interest. Wherever I've held responsibility and whatever I've done over the years, my style is always to be collegiate, and that will continue moving forward. So I will simply say beyond that, I look forward to working with you all as we start to progress things. So thank you for that. Councillor Tuckwell, are you indicating?
No, I was just checking that I was on mute, so no.
Beg your pardon. Right, okay, fine. So moving on to the main business of the evening. Apologies for absence. I understand that no apologies have been received. Declarations of interest in matters before this meeting. Are there any matters to declare any declarations of interest? None declared that I can see, so we'll move on from that. Third part is to receive and agree the minutes of the last meeting. So I will move those minutes, and in doing so, I will just observe that we have received subsequently some information about the carer strategy, which was sought, and this was the meeting held on the 26th of November, and I so move. Can I take it that these minutes are agreed? Again, silence as assent, no indication, so thank you. We'll move on from that. Thank you very much. And then finally on this part, to confirm public and private reports, and all of our items this evening will be in part one. Good. So we move on to the first paper of the evening. Bear with me a moment. I'd just like to say a little bit to introduce the Autism Friendly Review, because this is something that started life towards the end of 2019. It's had some twists and turns along the way. We've had changes to committee membership, and the schedule of meetings has been impacted also by the pandemic. And it's a shame for me personally, coming in at this tail end of things, really. The reports make very interesting reading. There's obviously some great things going on, both within the local authority and in partnership, but we must remember that the focus of this review is on council services. Also, we've had some information regarding the findings of the various witness sessions we've had so far. We've heard from the service managers themselves, and yesterday Liz shared some additional information from Hazel Ashworth, which, although broader in scope, is our focus. There are some real positives in terms of improvement, which are directly relevant, and I thought you should see those ahead of the meeting. We'll talk about that later on. I think it does highlight the challenge of viewing council services in isolation in an area such as autism, where so much happens in partnership with health and voluntary sectors, so we do need to be mindful of that. Speaking of which, I attended the AGM of the HACS last night, and Tony Mullally was very complimentary about the contribution she was able to make, and I duly thanked her, and she will be taking a keen interest in this moving forward. This isn't the end of the story, though, by any means, because there will be new legislation coming, and the publication, I think, of the National Autism Strategy. So whatever it is we decide to move forward with in the form of recommendations to Cabinet, this isn't the end of the story. Clearly, we will need to revisit this in the future. So now, really, it's a question of taking stock, reflecting on what's come out of the sessions, and to distill the essence into areas for officers to work on, to explore for feasibility, and this will hopefully lead us to a set of coherent recommendations that we're comfortable to put to Cabinet, but things that really will make a practical difference. The usual rules apply as far as budget implications are concerned, and of course they must be within the scope of this review. The last thing I will say is there are several officers present who are here in, just observing, really, rather than to comment, possibly to answer one or two questions if they come up, but I would stress this is not an additional witness session by any means. And I would just say that the officers that we've got that are here with an interest in this particular item are Kate Kelly-Talbot, Poppy Reddy, Dominica Michalik, and Carol Lewis. So, coming on to the paper itself, I've got a few ideas, but I want to float perhaps two or three of them to begin with, to see what comments people have and to see what additional points people might want to throw in. Remember, at this stage, these are ideas that officers can go away, do some work on, test them for feasibility and cost and all the rest of it. And I'd be interested in your views on these things and to find out what other points you might want to raise. So I think the first point for me is to ensure, bearing in mind what we've heard from the service managers, that there is a corporate checklist to ensure that there's a consistent approach to all public-facing service areas in making them autism friendly. I think that's quite an important one to work on, given all that we've heard, and it touches on various aspects. I think a second point that I would talk about would be in relation to training, and I think we can certainly welcome the training that's happened so far, but for frontline staff training to become really part of the mandatory training offer delivered and a core competency developed to support this. This seems like an area to explore. It's good that it's happening, but it does seem like an opportunity based on what we're hearing. And I think at that point I'll shut up. I have got some further things to add, but I'll be interested in any response to that from colleagues, and indeed any further points they might want to throw in. And Janet, you seem to be indicating, so do please speak.
Yeah, I read the whole thing from cover to cover. What concerns me is page 40. To go this the thing up in that training, it's got that staff, frontline staff could benefit from the autism awareness training. I'll be perfectly honest with you. I think that all frontline staff should be encouraged to have the autism. I don't think they should be offered the choice, to be perfectly honest with you. I mean, many of the mums that I work with, as you know, in a lot of different roles, have got children with autism, and I'm amazed at the variety on the spectrum from which people sort of, which is minor, right through to Asperger's, which people just think that the people with Asperger's are a nuisance. They're not. They've actually got something wrong with them, and I can speak from experience because my oldest son, it turns out, has got Asperger's. He's obsessed on things, highly intelligent, but he was fantastic as a child. Everybody thought, what a little adult, he's wonderful. But as he got older, he suddenly realised there was something wrong with him. But that many years ago, autism didn't exist. So he's sort of in his own head a lot of the time. And I think that because I regard it, and I always have done since I found out more things about it, it's a hidden disability, and people need to scratch the surface and find out the whole spectrum of it. And I honestly think that you're right. All frontline staff need to be trained on it, and that includes the guys that do the rubbish and things like that, because they may interact with somebody and just think they're weird or they're horrible or this. And I think people need to know all the different aspects. Does that make sense? I'm impassioned about this, actually.
Indeed. Well, my background, as you probably know, Janet, after all these years of human resources, I did talk in terms of a mandatory training offer, but this is something that clearly we need to offer to go away and look at and report back in terms of workable recommendations. Really. So I absolutely note your point, and I do see where you're coming from. So that was that one. I think Councillor Hagar, you indicated.
Yes, thank you, Chair. Well, I completely agree. I think training is really important, and I think as well when it comes to things like our front desk, so our front line, straight as we walk into the survey, the staff on the front desk are trained too. And when I mean trained, don't just mean we can do training online. I think there's nothing more beneficial than actually training when we can eventually on a one-to-one face-to-face. And I think that really has a big part. I think unless you're actually in that learning zone with autistic, which is just what Councillor Gardner said, it can be difficult to actually manage. And I also quite like to pick up, when we have the friendly signage as well. I think all that as you come straight into the civic and around that area is really important.
Yeah. Thank you. And I take all that, and I think aspects of signage, the fabric of the building in those public-facing areas is very much what we're talking about in that first recommendation. So that is noted. Do I have anyone else indicating? Councillor Tutwell, were you indicating? Please.
Yes, I was indicating this time, Mr. Chairman.
Okay, got it right.
For me, I think being relatively new to this POC and coming in after the review had already started, looking at what's been achieved so far, one of the key pieces of information that I'm drawing sort of inspiration from is the survey that went out to council services, and it's been mentioned around training and signage, but there's so much more in terms of the responses that have come back that I think could be certainly learned from, used as a bit of a compass in terms of what recommendations come out to go to cabinet, but I think could also be used after the review is finished as a sort of before and after to sort of see, that there's been a shift in terms of, some of the areas which there are a lot of no's I noticed in the responses, which is understandable. But I think for me, being able to sort of turn these no's into yeses, which would then complement the training, complement the signage that we're talking about. So I'd really like to sort of see some of that built into not only the recommendations, but sort of a way of working going forward.
Quite, indeed. Well, I think the recommendations pick that up. Certainly the Steve is making notes furiously as we go to weave all these things together in a coherent way. Anyone else indicating at the moment? Tony, you're indicating. Please go ahead.
Yes, thank you, Chair. Yes, it's quite interesting, the response, the survey which was done of staff. I'm a bit worried that there seems to be a relatively low level of involvement in the current training for dealing with autistic people, and it was quite difficult to understand. I realised that any sort of survey, it's difficult to summarise the results, but I found it quite difficult to understand all of it. But it does worry me that there seems to be a suggestion that some people believe that the existing ways of contacting the council are sufficient. I'm not sure that autistic people are happy with telephone or even email, perhaps, and certainly not attending the civic centre. I would have thought that may well be a struggle for some people without support. So I think there are ways in which some of the respondents to the survey perhaps should consider more training and seeing whether there are ways in which the council can support autistic people better. Yeah,
indeed, and I think that speaks very much to what we've been talking about already in terms of the environment in which we operate to improve the experience of people accessing services. Councillor McFarlane, you're indicating.
Thank you, Chair. Out of one of the witness sessions, this was the session where we had the Hillingdon Parent Carer Forum. What struck me was how parents need more support, especially if their child doesn't actually have an educational healthcare plan. We heard from one mum in particular, and her story really stayed with me, where she felt that she wasn't supported enough. So we need to make sure that we are finding a way to support these parents on their journey.
Just a question on that, Councillor McQuarrie. Are you talking in terms of children who fall short of the threshold for a statutory service? Then you're talking about that sort of provision.
Yes, that's right. Yeah.
Okay. I mean, I was going to come on to say, Councillor Cooper, I know you've indicated. I'll call you in a moment. I was going to come on to say that has come out as an opportunity, and it's I wouldn't call them preventative services. You can't prevent autism. You can help people live with it better, but there is this question about use of resources for people who fall short of a threshold, I suppose. I can see that Carol Lewis is indicating. Was that with a view to comment on that specific point? Because if you can give us some clarity around it without reasonably briefly, that would be helpful.
Yes, I want to respond to that statement there. Just to say that the advisory service, we do offer training to parents. We offer workshops. So we offer something called Early Bird, and we also offer Signets. So that Signets is accessible to families with children with autism, but also with children that present with social communication needs. So not necessarily with a diagnosis of autism. And we've pledged to increase our offer. So we do offer this on a termly basis, and we generally have between 8 and 16 families per term. But our pledge is at the moment we have a backlog for that, and we are aiming to increase our delivery over the next, I would say, 3 to 4 months. So yeah, we do support that service.
Okay, and that's helpful, Carol. And that really brings me on to a couple more of my points. Again, I just want to float the discussion, because one of them is to explore options to improve access to information about how to access council autism services at one centrally located access point. That came out from the HACS witness session. I think I saw that in one or two other places. So again, that's something that I'm going to float. Don't feel you need to comment on it, but if I can take it, we're happy with that. That's fine. That's one other one I wanted to move. Councillor Tutwell, you're indicating again. Is that from last time? Did you want
No, it's another point, but I'm conscious that Councillor Cooper wants to come in.
Yes, indeed. Well, Councillor Cooper, I beg your pardon. These hands only stay visible for a period of time, so my apologies, Councillor Cooper. Please go ahead.
Thank you very much. I hope you can all hear me now.
Yes, thank you.
Good. Okay, and I apologise. I have missed chunks of this meeting, so I may be saying things that you have already covered. First of all, could I say that I think that not just tracking outcomes is crucial, but I think we should also be monitoring outcomes. So if we could make sure that the officers are working with partners to develop effective procedures for both tracking and monitoring outcomes, that would be really helpful, I think. And
okay.
then if I could add to the point that you were making, Philip, an additional benefit of having the one front door, or what I know as Tell Me Once, is that it would provide a pool of knowledge and experience for improving services, and that could be a very efficient way of acquiring and processing data. And I think in the early stages that would certainly be useful. Okay, and there was one other thing. I don't know whether you have covered safety procedures. I know it's in the reports, I know it's been covered, but safety procedures to deal with unexpected responses. So, for example, if a client needed to leave an environment because they were overwhelmed. And I think not only is that important, we should have clear safety procedures for dealing with people who might suddenly and unexpectedly perhaps leave a meeting or respond in a way that might be perceived as being irrational. And I think it should be extended to instances where, for an example, an interview or a meeting has been terminated by the client, and this should not be viewed as withdrawing from the process, which I think it is in some council processes. There should be a process for continuing the interview and the meeting without prejudice to the client or his case, and where appropriate, maybe a review of the circumstances in which the interview or meeting is conducted. The basic point is in the notes and minutes somewhere, but I just thought that I would add to that, please.
Okay, thank you for that contribution, Councillor Cooper. And I think that fits quite neatly with the first item that I was suggesting about the public-facing environment. So I think building in a component that takes account of the sort of safety procedures you're talking about for those sort of eventualities, I think would be certainly worth including. So I'm going to, I've noted it here, and I know that Steve's picking it up as we go along. So that's helpful. Thank you very much. Councillor Tuckwell, you're indicating again?
Yeah, just a quick point, Mr. Chairman, in relation to the last meeting, we had a really informative presentation from HACS, and towards the back end of their witness session, I know that a couple of members pushed them on the work that they're doing, early intervention work, particularly with primary schools, and I think that's something that we certainly need to include in our recommendations to prevent the sort of what goes on in later life, you know, try and deal with it nice and early. So, but that was a very informative piece of information that HACS shared in terms of the work they're doing with primary schools. So I think, again, including that is very important. That was it, Mr. Chairman.
Thank you, Councillor Tutwell. That's something that both I and Steve would have picked up, and something that I think we can take forward. All of these things will need to be road tested fully by officers, and that they will need to come back to us on visibility and cost, all the rest of it. It's certainly something that we need to look at. Absolutely. So, Councillor Hagg, are you indicating again?
Yes, Chair, thank you. And one of the things I just pick up as well was one actually that Judith said was about procedures. I think communication, as we know, is one of the biggest issues around autism, and actually knowing how to communicate and what is expected as well. So I would like to know a little bit more about the Wigan Council's passport that they're using, and whether that's something that we can, you know, jump on the boat with, and whether we can duplicate that, because I think that is a massive piece of work that could be really beneficial for a lot of parents as well as their children and the adults, obviously, the adults with autism. And I think because that includes access, it's when we're reading here, it says access to surgeries, council services. You know, if it's all on one card, something that they can access straight away and everything's in one place. Because I think that is a big issue. And when we were listening to the feedback, going to different places is not appropriate. It has to be in one area and they have to know how to access it. So that would be, I mean, for me, I think that's really important, and that covers quite a bit.
Yes, and there are one or two things for me to come on to still in terms of other recommendations, but I think it'd be helpful to, I mean, is there an officer in a position to comment on that at all? Otherwise, no one's indicating. I'll tell you what I'm going to do then. I'm going to ask then that we receive some further information around that will help inform our decision making next time round, if that's helpful, Councillor Hagar. Because what I was going to come on to talk about, a couple of other recommendations that I'd considered, was to explore the feasibility of a one-door approach for service users with autism in terms of accessibility for services. I was going to suggest that we consider the merits of seeking autism-friendly accreditation. That's something that could well add value in the context of what we're talking about and cover off a lot of the things we're highlighting here. So I don't know if there's any immediate comment on that or any further people indicating. Councillor Hagar, indicating again. Do you want to come in again, or?
Oh, no, I've got to lower my hand.
Okay, no problem at all. If I can take it from that, Councillor McCartney, you want to come in?
Yeah, thank you, Chair. I was just going to say on the back of what you just said, there was another suggestion could be about having an autism ambassador perhaps within each department. I mean, it was something that was raised with when HACS actually came to a witness session, but I think that would be quite a good idea where it's somebody who is maybe a bit more of an expert or specialises in maybe just autism in general, and if they don't actually have the answers to the questions being raised, perhaps they can liaise them with HACS. So I thought that was a good idea.
Okay, and I don't know if there's any officer comment to that, but I just in response to that, I would say whatever we choose to call it, it could be a centre of excellence within a department or whatever. There were people with high levels of knowledge, so that's something that I think we could explore alongside the training item, because they kind of complement each other, I would have thought. But Janet, Councillor Gardner, I beg your pardon, has put her hand up. Councillor Gardner.
Yeah, I just had a brainwave. Well, just one. There have got to be members of staff who have got either family members or, you know, intimate family members or children or whatever who know about autism. It might be worthwhile asking, just put a general survey round, because they're the people that can provide the information about all the different strands. And honestly, that is the only way that I have learned about all the different aspects, because somebody said, oh, he's got science. I mean, one mother spoke about the constant fireworks. I won't go into the ins and outs of that, but her child suffers from problems with noise, and he has to wear noise cancelling headphones. He also has to wear them at school so he can only concentrate on one thing. Well, I didn't know that. And then there are other different aspects, but I'm sure the members of staff, we've got to have family members that have got autism. And I think they might benefit from thinking, well, actually people care about what we think. So they can then put into that and let us know what we need. Okay. Yes,
and I think in one of the witness sessions we have heard from experts by experience, if that's the right expression. So it's good to have that, and I think there's scope to harness more of it to inform how we shape, or rather how we recommend the services shaped moving forward, I think. So again, Steve will have picked that up as we go, so we can talk about that at the end. That's helpful. Thank you very much. I had a couple more things to, no one else is indicating, oh, I beg your pardon. Kate and Carol are indicating. Do you want to just comment quickly on those items before we go any further? Looks like let me ask Kate to come in, if you would, first.
Thank you. I just wanted to come in on the experts by experience, because a number of the issues that have been raised, certainly in terms of the training and the web pages. Our work sits through the Autism Partnership Board. We are working with our board of experts by experience. So we have 5 adults with autism on the board, and we are very much trying to work in co-production with the adults, with the experts by experience.
That's helpful to know, Kate. Thank you for that. And Carol, do you want to add something to that?
Yes, sorry, I'm new to this arena. I'm not sure it's the right time to add this, but we do provide a comprehensive training package to schools. We do central borough training, and we also do inclusion commitment, which is a 1-year training programme, which is upskilling whole school. So it's from everybody, caretaker through to teachers, through to senior leadership teams. And that is specifically in a strand for autism. Not sure if you're aware of that.
No, it's helpful to know, and it's useful context, because when recommendations eventually come back, it will need to pick up existing good practice, some of which we won't necessarily know about, though we've had several witness sessions. So it's good to have that contextual comment at this point. So thank you for that, Carol and Kate. Let me just move on to a couple of other final points I wanted to just highlight that I think we can work in usefully. And that's we must recognise the good work that is going on. So I think we should welcome the culture of continuing improvement that I think we do pursue within this service area, and welcome such improvements as the appointment of an advanced social work practitioner with a focus on autism, the development of e-learning training. Granted, that's something that we can develop, but it exists and it's being rolled out, and a clear council-wide policy on reasonable adjustments under the DDA. So there's a relationship between that and the wider environment that we're talking about. So I just wanted to add those comments. And I think my final observation on this, I suppose, is coming back to what I said earlier. This is a work in progress. We've got legislation coming down the line. We've got the autism strategy. So those things will require a fresh approach anyway. So I think we're at the stage now where we do need to be saying we've been looking at this for a year. Let's see what we can work up by way of recommendations that will add value, drawing upon our experience, but recognise that at some point in the future, I don't know exactly when, we will have to revisit this to pick up how those changes have been implemented and how we're approaching the wider national legislative changes that are coming down the line. So really, I'll just make that observation, I think, in sort of concluding essentially what I wanted to say. Okay, any other comments on this item at all? Any other comment suggestions? No one's taken issue with me on anything I suggested here, so I'm hoping that means that you're broadly comfortable as members with what I'm suggesting. I think that's been a very useful discussion. It's been good to get those different aspects out. I think there's plenty we can do with this. So what I'm going to suggest, I mean, there wasn't too much in the end, so I'll perhaps just give a quick summary of the points that we've picked up, just to make sure we're all comfortable with them. My first one was around a consistent approach to the corporate public service facing environment in a way that's autism friendly, picking up the safety procedures that Councillor Cooper spoke about. My second one was really around training and making this part of the mandatory training offer delivered and a core competency to support that. Again, we may be some way down the road on that, and again, we need to hear from officers, but that's what we're putting forward at this stage for consideration. I've spoken about the feasibility of a one-door open approach for service users with autism. We've spoken about exploring options to improve access to information and how to access council autism services at one centrally located access point. I've spoken about seeking autism-friendly accreditation, and I've made a couple of general observations about existing good practice and the impending autism strategy and changing national legislation. A couple of other things were picked up. One was early intervention in the primary schools. Again, I think there is some work going on around that, but I think we need to understand that more fully and see how that could perhaps be complemented with recommendations. And the last point I've got is Councillor Cooper's one around monitoring for outcomes in terms of people accessing services. Essentially, that's what I've captured from this discussion. Hopefully, Steve is more or less with me on that. Are there any other comments, or can we ask officers now to go away, look at this, sort of fine-tune it, and then come back with some recommendations which work with where we are and which could add some practical value. Are we comfortable to leave it at that? Okay, no one seems to be. Councillor Cooper, are you indicating again? Did you want to comment further?
Yes, please, Philip, yes. I haven't this evening heard any reference to children in care and foster carers, and I would like to be assured that they will appear in the final report with a recommendation.
Okay.
A specific reference to them in the recommendations.
Okay, okay. Is there any of us are able to comment on that at all? Okay. I mean, I think that sounds entirely reasonable. Again, Councillor Cooper, like everything else, we need to see what we can work up. Look at where we are, benchmark where we are, see where there are opportunities. So I think Steve will have captured that too. With that, can we agree the points that we're putting forward, and can we move on? Is that agreed? Okay, thanks everyone for your contributions to that discussion. That was very useful. Thank you. Okay, so we're moving on now to the second item, which are the budget proposals, which are out for consultation at the moment. And I'm going to ask Gemma McNamara to introduce this in a moment. Essentially, there are three parts to this item. Gemma's going to introduce it. There'll be an opportunity for us as members to comment and ask questions. And then we've got the task of seeing if we can agree some comments that we're happy to put to Cabinet. And we can either do that this evening, that's my preference, or if necessary, they may need some further work, and it may be necessary for Councillor Egginton and myself to look at that offline. Let's see how the discussion goes and where it takes us. So with that, can I ask Gemma to introduce the report, please?
Yes, thank you, Councillor, and good evening, councillors. Apologies again that you cannot actually see me this evening. This is the second budget report of the year, following the report that I presented back in September. In contrast to the last update, which outlined the context, this report covers specific budget proposals within the social care, housing and public health POC remit. It will outline the budget headlines, followed by a summary of the savings being presented, and then I'll welcome any questions that you might have. Since last meeting in September, we've had the Chancellor's Spending Review 2020, which provided a £1 million uplift in the funding from grants, alongside an increase in the social care precept by a further 1% to cover ongoing COVID-19 related pressures in the sector, and an inflationary pay freeze for public sector workers. As a result of the pay freeze and the additional grant funding, the headline savings requirement for 21-22 now stands at 16.3 million, a £3 million reduction on the 19 million we anticipated last February and briefed the committee on in September. Cabinet's budget proposals were approved in December 2020 and set out the following: a 4.8% increase in council tax based on the implementation of the social care precept, and a general uplift pegged to 90% of the likely increases across the capital, with the additional 1% income from the Spending Review 2020 being earmarked for emerging COVID-19 pressures. This contributes 5.862 million towards the budget gap. The report also notes the freezing of discounts for households in receipt of the older people's discount after 14 years of freezing council tax for this group, which provides circa £1.5 million of support for 16,000 households. Savings proposals totalling 8 million, with 2.5 million of this sum relating to the services within this committee's remit. Please note that they are overwhelmingly efficiency savings, including service transformation, with a 500k saving from the winding down of the first-time buyers scheme now that the central government are providing this support through the Help to Buy programme, amongst other schemes. And finally, a release of 2.4 million from balances is proposed. Overall, an improved position in the medium term from September, with significantly reduced call on balances, leaving 27.7 million of general balances available to manage the range of risks faced by an authority such as Hillingdon, comfortably within the recommended £15 to £32 million range. The full year effect of the current savings, or the savings proposed for 21-22, will deliver 2.8 million of efficiencies in 22-23, with a further 12.6 million of savings to be identified for the years 22-23 and 23-24. Note that this does pretty much put us back into our pre-COVID-19 position, but we do need to look out for any HM Treasury response in terms of future funding levels. With regard to the specific savings, in total savings of 1.75 million are put forward for social care, which predominantly relates to zero-based reviews of the demographic pressures within Hillingdon, which accounts for 1.25 million of this figure. Each year, contingency growth is added to the budget to reflect the increasing demand on both children's and adult social care services. The savings and contingency balance out the growth required across the borough. However, this is kept under close review as a result of the volatile nature of these demand-led services. In addition to this, a service transformation review of the service is expected to generate 150k of savings from process efficiencies and a review of staffing to ensure that the work being carried out is at appropriate levels. And also the leasing of part of the Civic Centre to one of the council's care partners is anticipated to generate a further 100,000. Finally, contract efficiencies within public health of 250k have been negotiated and will enable further spend to be undertaken to meet the council's public health priorities within the ring-fence grant. Within housing, savings of 750,000 have been put forward, rising by a further 250,000 in 22-23. 500,000 of this, as I mentioned previously, is from the closure of the first-time buyer scheme in light of the other support in this area offered by central government, including Help to Buy equity loans, shared ownership and first home schemes. The remaining 500,000 is planned to be delivered over a 2-year period and is focused on improved management of temporary accommodation. That was all I was going to say to summarise the report, but I'd be very happy to take any questions that you might have.
Gemma, thank you very much indeed. I'm sure there will be some questions, and if the fact Councillor Egerton is indicating, as is Councillor Cooper. Were you indicating, Councillor Cooper, on this? You weren't. Okay, your hand up at the moment. Councillor Egerton.
Thank you, Chair. Yes, I think you mentioned, or Gemma mentioned when she was going through 250,000 savings related to social care. I didn't see that in the report, which was why I was a bit surprised the figures didn't add up. But there were a few things which I'd like to ask, if I may. And really, it's to do with some of the figures within the development and risk contingency. Looking at all of the figures in paragraphs 31 to 35, the figures of provisions there seem to be for the current year, that is 2021, that's 2020 to 2021, rather than next year. Is that right? And therefore, are the growth or adjustments to be added on to those figures? In particular, I noticed that some of them, the provisions seem to be way out of line with the actual forecast for the current year. For example, in the figure for asylum funding shortfall, there's a provision of over £1 million, which is unchanged from last year, and yet the current forecast for the current year is less than £600,000. And I wondered why that was. That's in paragraph 35.
Okay. Okay. Can I bring you in again, Gemma, please?
Yes, no problem. So in terms of each of those paragraphs, the figures that are showing the growth that has been, obviously we based it on the current year position, and then we've added growth onto the top of that. So for example, for support for looked after children, it represents 656k's worth of growth, which we're expecting to see through the system for next year. I would also point out that the impacts of COVID in this area are still being determined on a long-term basis, so they're not included in the growth figures currently. Over the course of the next year, we'll deal with those on a one-off basis and then look to redress those in 22-23. With regard to the figure for asylum funding shortfall, the £1 million is the contingency element on top of the base budget that we have. We are showing a slight underspend against that, and that's part of the realignment that we're going to be doing with the savings that are shown of 1.25 million. 0.25 of that is expected to come off of the contingency. So there's a slight quirk in terms of the accountancy presentation that we have with the contingency growth and with the savings offsetting it. I'm not sure if does that answer your query. I'm afraid it might go into a bit of presentation on the accountancy side.
Yes, I think it does. I think it would have been helpful to have included the provisions as the provisions for next year rather than the provisions for last year, so at least one could understand what the totals are. One thing which I also noticed, I'm not sure, going on, the zero-based review, you're talking about that being able to save, well, it seems to be 1.25 million now. That seems a very large amount, particularly bearing in mind the uncertainty at the moment with a lot of expenditure because of COVID. And I wonder whether it would be helpful, it would be possible for you to give a bit more details as to, you've said you expected to be able to save some of this on the asylum funding shortfall. Are there any other items, other areas where you believe that this sort of zero balance budgeting will be able to be achieved?
So as part of the budget setting process and the budget monitoring process every year, we would undertake a very similar zero-based review. So when we're looking at the demographics on the client basis that we have, obviously those demographics have changed quite significantly this year, and we offset it against the contingency growth and the savings that are presented. We'll continue to do that. It's just the way that we show it, it does split out the savings and the contingency. And as I've mentioned, you quite rightly state about the volatility and the uncertainty that we have currently, particularly in light of COVID, and that will be looked to be dealt with on an exceptional basis next year, with the budget build reflecting what we're expecting the underlying pressures to look like in next year. And then we'll address any impact of COVID in the year after, once we can see what the real ongoing long-term effects are of COVID.
Gemma, thank you. Any final points on that? Does that address the point you're making, Tony?
Partly, I think, but there was one particular area which relates to that zero-based review in paragraph 39, and it talks about the reduced headcount within adult social care. I mean, can you tell me what reduction of headcount that was, and how that has affected services in adult social care, please?
I don't have the exact figures, but I can get those. However, I think the key areas that we'd focus on is, obviously we've seen a decrease in the headcount in our residential and nursing sector, which has been greatly impacted by COVID. We have seen a slight increase on the home care side, and as we'd expect to do so with more and more people staying at home. And as with any year, although this is a rather exceptional one, as with any year from the finance perspective, we'd be monitoring against the client base that we have at each particular level. So that's really what represents that movement in the headcount that we've seen, which we're expecting to see across the adult social care placements.
Okay, well, if there's Gemma, if there's some further information on that which can be shared, that would be welcome, I think. Thank you for that, and Tony, thank you. Councillor Tutwell, did you indicate a moment ago?
I did. This raising of the hand button is.
I'm getting used to it. I'm getting used to it myself, I'm afraid. But yeah,
a hand wave. But it always amazes me, and I have to congratulate officers for pulling together all of these numbers that we're faced with, and particularly this year as we have got moving sands all of the time to build a budget on. So I think it's a really sort of well balanced set of figures that I know is in consultation stage at the moment and for us to comment on. But I think it covers off a whole host of social care areas, and also provides for the fact that there's likely to be, a lot of growth in some of the services that we provide. But one area in particular I'd like to just cover off is paragraph 33, which is on page 51 of the report, where it talks about additional investment in mental health service for last year. I guess this is probably similar to what Councillor Eggington just talked about. Just want to sort of try and get a feel for what that is by way of number for mental health services for the year ahead in front of us.
Apologies, Councillor Tutwell, you mean the amount that was actually put into the budget for last year? Yeah,
and it talks about, so it says here, following additional investment in mental health service. Does that mean there's going to be some additional investment in mental health service for 21-22?
The total amount of the increase across all of adult social care placements, which does include mental health, is 1.288 million as part of the budget build. And it's really, you're absolutely right, as part of that review that we do each year in terms of the demographics. Last year, it was identified that we had a real pressure in terms of our mental health budgets. And for the budget build at this time last year, that's when we put additional monies in, which was around, I think, £1.5 million into mental health, because we had identified those pressures coming through that needed to be addressed in the budget. So of part of that 1.288 that's for this year, some of that will go against mental health. At this stage, we're still working the final figures through. As you've said, it's a rather changing landscape currently, so it's still just to be determined.
I think all members on this committee just appreciate how much of a fine balancing act it is for all of you at the moment. So, but thank you for clarifying.
Thank
Indeed.
you.
Councillor Egan, you want to come in again? I don't think we can hear you, Councillor Eggington.
Pressing the wrong button, dropping my hand, and
right.
Okay, thank you for reminding me. Yes, it was to do with the capital programme. There were some comments on page 53, paragraph 45. One was the uplift in the budget for 1 and 2 Merriman site. I don't think I was a councillor when this, well, maybe just become a councillor when this was first introduced back in 2016. And I think it would be helpful to know exactly what this is and why it's taken 5 years so far. And I believe virtually no expenditure or nothing really has been progressed apart from some outline planning. But the other point was related to the saving on the budget for what's described as PSRG/LPRG. I don't know what that is, to be honest. I don't think an acronym. I'm sorry. It would be helpful to know what that is and why there's a reduction. Whether the grant, I guess it's a grant of some sort, has actually been paid out in the past. And whether has been advertised in the past.
Okay, a couple of things there, Tony. I mean, the PSRG bit we'll ask Gemma about in a moment. You're making a broader point about Merriman's. I was going to welcome the investment later on that on this item, but I don't know whether perhaps possibly Tony Zaman, you're here observing the meeting. Any observation on that? Because as I understand it, this is something that it's been a work in progress for some time, I think, Merriman.
It has, and there's been a combination of issues, Councillor Corthorne. Some have been around, when I say the suitability of build, I mean the design of that, of the build, in relation to the types of clients that HACS were wanting to receive there. So it's been not, I think it would be fair to say that's not from any sort of challenge on either side. It's actually just a range of technical issues in terms of sorting out the design and the build. And that's changed over time. And it's something that I'm picking up with, funnily enough, Councillor Palmer in my next briefing with her, because she's asked the same question. So we'll be able to provide a more sort of thorough sort of pathway of when that work's going to be sort of undertaken and for whom. As I say, because it's been a combination of the right clients and the right type of design. Because I don't know if you know the properties, but they're quite small and quite specific buildings alongside Merriman's, the respite centre. So they've taken some designing.
Thank you, Tony. Before we come to the other point, I mean, certainly places there are very much sought after, as I hear from the parent carers when I used to meet them on a regular basis. Thank you for that. I hope that's the first point addressed. Tony. And then the PSRG points. Perhaps Gemma, can I bring you in on that, please?
Yes, and Councillor Eggington and other councillors, I completely appreciate that using that acronym is probably not the most helpful in that sentence, so make sure that we've explained those properly in future reports. PSRG is the private sector renewal grant, and LPRG is the landlord property renewal grant, and this has just been part of the It's effectively a zero-based review that's been done of those grants. They've looked at the activity that's been spent in previous years, and they've just realigned the budget accordingly with what's gone out. So we currently have 100,000 relating to those, and that's proposed to reduce that to 50,000 a year.
You're muted. Chair, muted.
Beg your pardon. You see, I'm learning all the time. Okay, you can hear me again. That's helpful, thank you. I've got just a couple of questions, really. I mean, noting the Better Care Fund and utilising that funding to better support health and social care integration, I think is a very positive thing. But I do know from past experience that can be challenging in terms of gaining agreement from health partners. And I just wonder what stage we're at in that regard. Is this something that everyone's comfortable with, or is that a work in progress?
We are certainly getting closer. I think Tony will be able to give more information. There's been an awful lot of work done. As I'm sure you appreciate, this has been a rather difficult year for all partners as well.
Indeed. The only other thing I was going to just ask, and I think Councillor, sorry, I'll bring you in, Tony, if you want to comment on that specific point.
It was just to add, of course, you're very experienced in the history of the Better Care Fund, but actually things are materially becoming real with the change in relation to the CCGs and the whole health economy. So as we move towards the integrated care pathway in Hillingdon, which is HHCP, Hillingdon Health and Care Partners, all of the work that we've done is over this year going to become real, almost really, because the CCGs cease to exist in the fashion that they did. All of the funding gets devolved to providers, so Hillingdon Hospital, GP Federation and CNWL, and so we'll be working with them sort of as providers rather than the CCG as commissioners. And within that, we then expect to see a shift of the money much towards the preventative end of the system, which of course includes the local authority and social care. So we expect to see some of the funding from health coming into social care over the forthcoming years. So it is starting to become very real now.
Indeed. I remember it well, and I wish you well with that. There are multiple benefits to this approach, and I very much welcome it, certainly. Councillor Eggins, you're indicating again.
Yes, may I just ask one further question?
Of course.
Okay. It was to do with the balances. There's in the report there's reference to the general balances being expected as at March 2021 of about £31,200,000, and Gemma referred to that as being within the spread which one would hope to be or to have. I believe there are also some earmarked reserves, and I wonder what those were. There was reference in the report to priority growth reserves of £1,038,000, but are there any other other reserves which have been earmarked?
Can you help with that, Gemma, please?
Yes, I mean, we hold a number of earmarked reserves for a whole raft of purposes across the council, particularly in light of this year, and that's one of the ways that we're trying to target the COVID spend for next year. As I'd mentioned, with regard to the 1% increase from the spending review, that will go straight into an earmarked reserve to take it forward into next year. Wherever possible, if we are aware that there is going to be a pressure in the upcoming year, then we do look to make an earmarked reserve. So there are many.
Okay, Gemma, thank you. All right, Tony. Okay. Are we there, Tony, or was that it?
Well, it would be nice to know what those are. It'd be nice
okay.
To have
well, let's ask Gemma.
It's probably not possible now, Chair. But
well, no, I don't imagine it is. But I'm sure that we can be furnished with that information upon request. So let me just make that request now, Gemma. If you can come back to us, please, that would be helpful.
Absolutely, no problem at all.
Thank you very much. And I think no one else is indicating, so I'm going to sort of sum up here a little bit, and then I'm going to suggest a form of words, bearing in mind we need to comment to Cabinet as part of this consultation. My observations really as follows. I mean, as Councillor Tuckwell has said, this is a very well constructed budget. It's indicative of the very strong underlying budget setting processes within the MTFF that have become so well established in the borough and have served us so well. And I would commend officers on their budget management, in particular with the challenge of COVID, and indeed frontline officers who deliver services in the most challenging of circumstances. We must certainly recognise that. What I'm going to do is I'm going to suggest some comments that we might want to consider as a committee for Cabinet, and see where we go with it. I'm going to suggest that the POC committee commends officers on the budget proposals, maintaining services for residents with appropriate contingency provision for service pressures. Proposals for priority growth within domestic abuse are welcomed, as are proposals within the capital programme for autism respite accommodation and the investment in general needs housing within the HRA. The committee also welcomes the approach for innovation delivering service transformation. This is what I'm taking from all this personally, and I just want to float that at this stage to see if that's something that perhaps Tony you'd be comfortable with. Any comments on that?
Yes, I'm the chair. Thank you for that, but I'm still a bit concerned about the suggestion of a reduced headcount in adult social care, particularly as the contingency development and risk contingency is expecting a larger cost for adult social care. So I think there ought to be something at least referring to the reduced adult care, social care.
Well, I think before I comment on that, let me just bring in Tony to see if we can bottom this out. If you wouldn't mind, Tony, please.
Yeah, thank you, Councillor Corthorne. So it's not terribly straightforward on the one hand, but on the other it is. So if you look at adult social care over the past 5 or 6 years, actually the headcount of the numbers of people being in receipt of services has changed by a very, very small margin. So we're talking numbers of sort of 10, 15 each year. So it's a very stable number across all of those years. But of course, the costs have gone up significantly simply because of inflation or complexity. And one of the ways in which I'd explain that is that if you look at the time from when we introduced things like reablement, the free telecare, there's various universal services in the borough, as well as those provided by sort of grants through social care and also other social care services. And so we've been able to reduce the numbers in the first instance of those who would have previously had no other choice but to be in receipt of social care services. So we've sort of stemmed the flow coming through, which isn't about, we've not cut anything, we've actually just offered alternatives in the borough to residents. And so we've now got the core of residents who have got higher levels of complexity and dependency, who are in receipt of social care services, and so by definition the unit costs for those people have gone up. Over the COVID period, as Gemma mentioned, there's been, for reasons which the other thing to sort of add into that is things like sort of the extra care developments as well, where again it's much, if you look at it relative to preventative work, then for residential and nursing care, extra care is preventative, if that makes sense. So we've got all of these things in place now. And over the COVID period, for reasons that are clear, there's been there's been an impact on the headcount, particularly of sort of older people being in residential and nursing care. And also because of over the COVID period, one of the other things that's happened, and again, Gemma may be better qualified to talk about it than I, there's from roughly the end of March, the NHS have funded all placements for people coming out of hospital, and the local authority has contributed just what it would have ordinarily contributed in. So over the year, there's been no net impact on the financial status of the local authority social care finances. But all of that has also meant that sort of more people have gone into continuing healthcare places as well, which means that they don't come onto the books of the local authority. So there's a whole range of things over this year where the headcount is reduced. But as Gemma mentioned earlier, one of the things that we would expect to happen has happened, where there's a reduced headcount in residential nursing, we see a slight increase in domiciliary care, in home care provision, where we're supporting people in their own homes more. So there's nothing, I don't think there's anything terribly surprising sort of about that, given the status of the COVID, and some of the earmark reserves that we have are there to address if there is an impact sort of after COVID, and we're already planning into that, expecting there to be a bulge. But a part of the MHCLG grant that we get for COVID will also help to cover that off, so it won't be out of the base position of the local authorities' budgets. I don't know if that's a reasonable summary, Gemma. Of
I'm not sure how many people followed that. You covered a lot of ground there, Tony. Just, have I muted myself again? I don't think I have.
No.
Right. Okay. Tony, I don't know to what extent that allays the concern that you've raised there. I mean, you may want to comment on that now. What I'm inclined to suggest, there's an awful lot of background noise, I have to say. Are we muted if we're not speaking, please? And I just asked. I'm getting an awful lot of background noise here. Okay, that's better. It's gone. So what I'm minded to suggest, if you're comfortable with the wording I've put forward, I suggest this point that you've raised that we take offline and talk about separately and see if we can come to a landing on it, because you've covered a lot of ground there, and I think that any further exploration of it would be worth just picking up elsewhere, if that's all right. We can do that. I do do that. But what's your response to what Tony said?
Yes, maybe I've just misunderstood it. Where it talks about reduced headcount, is that headcount of the staff in adult social care or the people who are benefiting from social care?
People in receipt of services.
It's those receiving the services.
Yeah.
Okay, Tony, I think Tony, if you're, are you happy with that and with the wording that I suggested? If that remains a concern, I'm happy to take it offline and have more of a conversation with you and Tony and see if we can come to a landing on it. If you're otherwise happy, then I propose that we adopt the wording that I've suggested in terms of recommendations to Cabinet. Are you comfortable with that?
Well, it would be nice to know what the figures are, so perhaps we should have a word afterwards.
Okay, I'm happy to do that. So I'm going to suggest then that we take this offline. It's good that we're broadly happy with the wording that I suggested, but let's try and bottom this out and then confirm the wording that we're all comfortable with. Are we all happy with that? Can I just ask that question? Okay, everyone's putting a thumbs up and nodding. So thank you very much for that. And can I thank Gemma? We can't see you, Gemma. Thank you for your...
Councillor Corthorne, sorry to interject. I think Councillor Cooper and Tony Zaman possibly raised a hand.
I thought, I beg your pardon. Okay, Tony, can I bring you in again?
Sorry, I was just going to suggest, Councillor Corthorne, if it would be helpful for Councillor Eddington and the committee, that if I have a discussion with Gemma, and we'll just put some words together around that sort of headcount point, and perhaps in the first instance have the exchange with Councillor Eddington and then refer it back to the committee.
Fine. Well, through myself, Peter, if that's okay. Is
Yes,
that agreeable to you, Tony? Okay, thank you. Councillor Cooper, you've indicated, I think.
Thank you, Chairman. Yes, it would be nice to have mentioned in your words something about how the committee welcomes the additional support for the domestic abuse initiatives.
I did. Well, I did actually reference that, Councillor Cooper, in my comments. I'm sorry if you didn't pick it up, but I did mention that. Okay, so I think we've reached agreement on how to take that forward. Thank you very much for your input, and thank you, Gemma, for doing that so well, and to Tony. Let's move on to the next item. Thank you. So with that, we move on to the voids management update. And this is a regular scheduled item that we're taking, and a very familiar face to me. Rod Smith is going to be talking to this, and after all, listen with interest. No doubt we'll have some questions. Over to you, Rob.
Okay, good evening, everyone. I'm just going to take you through the headlines of this report. Really, it's about sharing with committee to help understand our empty property management, also known as void property management process, and in particular some of the contributions made by a range of service teams and some of the interfaces in the end-to-end process of voids management. Important perhaps to state up front that the empty property management really is a core landlord service, just like collecting the rent and doing repairs. It's quite a fundamental process. The end-to-end process is not vested in any one single team. There are a range of service teams involving a number of handoffs in that process, from a property becoming empty all the way through to it being re-let. Empty properties represent a loss of income to the council, not just a loss of rent, but at the same time, if we have property empty, then we're denying a household, a family, access to a unit of social housing, and they may well be in difficult circumstances. They may well be in poor quality accommodation, overcrowded accommodation, or indeed high cost temporary accommodation. So it's important that we keep the number of empty properties to the lowest possible, really. Table 1 on second page of the report really sets out some of the key service teams that are involved in the empty property process. Some perhaps more obvious than others: a lettings team and a void repairs team, but we also make use of counter fraud team, work with the tenancy management team, contact centre, and a range of teams to bring the whole process together. Getting on to the detail of the end-to-end process, again, I'm not going to take you through every item, just perhaps some key ones in particular. Not a surprise that our empty property team in the repairs service have input on each and every void without fail. They have to carry out service checks, make sure the property is safe and that it meets the minimum lettable standard, and the detail of that is set out in the report. Perhaps something worthy of mention are the proportions of empty property which the void repairs service classified as routine or standard voids, and the proportion that require more intensive work. They're perhaps major voids or what we call sometimes non-decent voids. Going back to last year, 1920, of the 265 voids that went through the process, were defined as standard voids and 288 as major works voids. So about 52%, over half there, of the empty properties coming forward for re-let had to go through quite significant work. Bringing that up to date into this year, we're running at about 42% of the voids which have come through require more intensive work. And perhaps stating the obvious, the major voids are more expensive to turn around because there's more work to be done. Advertising and shortlisting. Some members will be familiar with the fact that we use choice-based lettings, the locator system, to advertise the vast majority of our empty properties, and they bring forward shortlists, and we work from those shortlists to bring forward applicants to view those properties. Before we do that, we involve our counter fraud team in a number of sometimes face-to-face checks, but also desktop checks as part of a policy response to really just double check right at that final stage that the people coming forward are still eligible for council housing and are still eligible for the type of property that they may be allocated moving forward. All of our properties are subject to accompanied viewings, so we have dedicated viewings officers who meet people on site, take them round the properties, answer any questions, and try and pick up on any refusal reasons or concerns as to why a property might not be suitable. Also made reference to the voids management group. It's a group of senior managers that came together back in 2019 and are still meeting on a weekly / fortnightly basis. And that group really came together as part and parcel of recognition that the voids process is not embedded in any one team, in any one service. So it's helped to bring together the various disciplines and the various teams on an operational basis, but also have to have management oversight of the whole end-to-end process. So the rest of the section there on the voids management group is really just setting out the sort of data set that the managers look at on a regular basis, how they categorise voids, and a wide-ranging data set, almost down to scrutiny of individual voids that are let each and every week to see if there's any learning points that can come forward. The changes that group has really brought forward over the last year or so have been beneficial in terms of operation of the service and performance as well. They've introduced a tracking system which really brings together the lettings team and the void repairs team so that the lettings team can actually see in advance how a void is moving through the repairs process and the key date, the estimated date that property is due to be handed back. So they can work in advance to start to schedule viewings, start to bring forward the shortlists and have all that ready by the time the keys come forward for the viewing. We've also worked through a new service level agreement with colleagues in counter fraud to make sure that all the checks and balances are done and ready as soon as a property is ready and we've identified a suitable applicant, so there's no delays. We've also been piloting some viewings while works are in progress to try and improve performance there. So this isn't while we're stripping a property back to its bare essentials, but really towards the back end of the work where it's safe for somebody to be in there on an accompanied basis to show them round, and that can often shave off a week or so off the end-to-end relet time. One of the more significant and more recent changes, we re-tendered, or colleagues in our repairs and maintenance service re-tendered the voids contract as well. And we moved from a single contractor to 2 void contractors, one working generally in the north of the borough and one in the south of the borough. We also changed the specification of that contract, but in summary terms, it's enabled us to move workflow around. So if we get a bit overwhelmed in the north of the borough, you never know when empty properties are going to come up. We can move work between the 2 contractors. And as you can imagine, it's also healthy to have some competition as well, where we can see how one contractor is performing compared to another. So that's been very beneficial. In terms of some of the other bits and pieces on our work plan moving forward, we want to accelerate the viewings while works are in progress. That pilot has now been kicked off more generally. We also want to change the verification process that counter fraud undertake. We think we can hold the levels of assurance, but do perhaps more desktop checks and more targeted checks for higher risk cases. We're doing work with adult social care in connection with the relet of our extra care voids in the extra care schemes that we own and manage. And that's really to try and bring colleagues in adult social care in line with our working practices here in housing. The pre-vacation inspections, we're also trying prior to the pandemic, we were trying to get into more properties before they become void. So where people give us notice that they're actually moving, then it's beneficial to try and get in, inspect the properties and start to raise works orders even before property becomes empty. Added to that, probably the last most significant point there as well is about the decent home standard. The government are looking to change the standards around the condition of the council stock and what we should be aiming for. And as I mentioned a little earlier, a fair proportion of the empty properties coming forward do require quite high levels of investment. So the more we can do on a planned approach, certainly the more economic that is, but also it will cut down on the relet time, simply because we wouldn't be doing so much work. So really, just to round off, there's a couple of appendices in the back of the report. The two that I really draw your attention to, we introduced there some sort of case studies, just to bring the voids process to life a little bit for everyone, just to see some of the range of voids that we deal with, and also a range of the performance information which we track and share on a regular basis. Thank you very much.
Thank you very much indeed, Rod. That is most helpful. This really is, I say this from experience, one of the most extraordinarily challenging areas of service. We've discussed it many times over the years. It's so important we make the very best use of our housing stock, from a housing needs perspective, from a rent generation perspective, and I'm delighted to see some of the things that are coming forward as part of that culture of continuous improvement. To develop things, and I'd ask you to take back sort of my thanks and that of the committee for the work of you and your colleagues in making that happen. I would couple of questions though for me. I'm interested in sort of sheltered housing to some extent in terms of the sort of void periods there, and in terms of whether they're a challenge in terms of letting these days. That's my first question, and the second one is around the proportion of non-standard or routine voids. Now, if you've got anything to say about the increased proportion of non-standard, which is what I took from what you said, Rod. Could you help me with those 2 points, please?
Yep, sure. On the sheltered side, as you can imagine, the vast majority of our sheltered properties are only 1 bedroom. So in terms of the amount of work that we need to do in a sheltered property, generally it's more limited. In that sense, the empty property time with void repairs is smaller compared with larger general needs stock, but we do have some challenges letting some sheltered schemes. Some are more popular than others, and there is a possibility that we may have an oversupply. It's something that we're looking at the moment. Certainly some schemes are more popular, and there may be some investment needs that we need to consider there. But generally, it either goes very quickly, or we do have some challenges, and we do go back and sometimes do 2 or 3 viewings on some of the sheltered stock.
Sure.
Okay. Moving on to the condition of property. Generally, the underlying issue is investment in the stock. Quite as simple as that. In terms of the number of empty properties that are coming forward that require new kitchens, new bathrooms, rewires, and so on, that is generally what's impacting on the void turnaround time in terms of the general stock, which is why really a planned approach and more significant investment in the insides of our properties rather than the fabric is what will help void turnaround time.
Okay, Rod, thank you for that. Now I've got 4 colleagues indicating, and in the order in which they appear on my screen, I will take Councillor Eggington first.
Thank you, Chair. Actually, I was going to ask the same question about the percentage of properties which need significant work, and I guess quite a lot of them also need new boilers to update those to improve them to the level which one would now expect. One thing which I noticed, because I've had a quick look at Locator, and I see that there are only 2 properties at the moment advertised there. One only has 1 photograph of the outside of the flats, and the other doesn't have any photographs at all. I wonder why there isn't a thought about trying to, I don't know, be an estate agent and try and sell the properties more, or at least, to try and sell the benefits of those. And I guess particularly for the sheltered accommodation, where I would have thought that with the aging population, it might well be that people would be willing to downsize from larger properties to move into smaller supported accommodation.
Thank you for that. Certainly some good points there. If you don't mind, Councillor Corthorne, in a minute, perhaps I'll refer to Melissa Murphy, who I've got from the lettings and the housing register side that might be able to help with Councillor Edgington's question there. But certainly sheltered housing is still popular. There's no doubt about that. But we are also very successful with supporting people in their own homes. And sometimes that can work against us, in the sense of providing care and wrapping support around an individual. So there is a fine balance. Clearly, we do not force people from their homes, and we wouldn't do that. But it is often a question, and we do have a dedicated officer that works on downsizing and really supporting particularly older people who might be in larger property. They're struggling with managing that property. It's expensive to run and so forth. So we do have quite dedicated support to work with people and encourage them to have perhaps make the right decisions for their future accommodation needs. But we do have some schemes, and I will admit, that probably need some investment to make them more attractive. And that brings us back full circle to the planned investment of the stock there. But perhaps if I could bring Melissa in terms of the advertising of our empty properties. Melissa?
Yes, sure, thank you. We tend to advertise the properties when we get notification that the tenant is going to be leaving, but the tenant is still in occupation. So we'll usually have a month's notice that someone's going to be leaving a property, and it's at that point that we'll advertise. So we refrain from putting pictures onto locators so it doesn't identify the property, because previously we've had people knocking on people's doors and requesting to have a look at the inside of the property. So we do it more to sort of protect the identity and protect the person that's still residing there.
Thank you, Melissa. Can I come to Councillor Hagar now, please?
Yes, thank you, Chair. I'd just like to really say what a good report this is. I really am interested in the housing and the stock and what we have. And hey, what council can say they can turn round a house on void and repairs within a couple of months? I mean, that's what it says in this report, and that's brilliant reading. Thanks for giving us the live case studies, because I do think they bring it to life, and they do bring the report into like a more human perspective, really. So thank you for that. Some of the questions I had actually, Rod, you were great and you answered them before. As I was writing them down, you were there answering them. One of the things that I'm really interested in is going to be our future plan. I think that's probably the same for all of us. You know, we're coming out of COVID. I like the way you said that we're going to look for more of a planned approach. I'm suspecting that some of our tenants who may have disabilities and illnesses, and even some that haven't, but maybe under hoarding, who will have hoarded a lot as the coming months have come up. So I'd be a little bit more interested to see how we can, because I really like the prevention approach, and I think that's really important. I think more so now than ever. So I was listening about how you're going to work with social services, etc., and getting in and getting them early. I'd like a little bit more detail around that, and whether we can identify our tenants that may have disabilities or you know, could well be a hoarder, and how soon we can get in to those properties, what our time around is. That was one thing. The second point was looking into the future again in the economy. How do you, I mean, I know it's very difficult to predict for the future, I understand that, but how do you see our need for houses and how we're going to manage that? So I'm thinking that we could see an increase need for property in all form and all ways, and how we're going to do that. Thank you.
Thanks. Thank you for that. Rod, can I bring you in on those for a response, please? I can't hear you. Rod, can you unmute yourself, please?
Sorry, not a flippant answer, but the reality will always be that demand will outstrip supply in terms of social housing, which is why it's so important for us to make the very, very best use of our stock and limit empty properties in terms of overall number, but also limit empty properties in terms of how long each property is empty. So that's why it's an important piece of work. Investment in the stock, but I think a better understanding of the needs piece is important as well. As part of the void management group, we look at perhaps an oversight of harder to let bungalows as an example. We've got some work at the moment in Nelson Lane, I think that's right, Melissa, where we've now nearly got empty 3 or 4 pairs of bungalows. We're looking at planning consent there to actually rebuild. We've got some structural issues, and actually open those up to more of an open plan environment. And we've put forward a request for the specification to include a design suitable for bariatric residents as well. So where we can, we're tailoring our approach, looking at specific needs, but also needs in general. And it may well be, again, that we've, as I said earlier, it's possible we've got an oversupply of sheltered housing. It may be that we want to potentially look at decommissioning a scheme, looking at alternative uses. We look at each and every property in terms of its potential for extension. You get corner properties, you know, it's very easy to put an extension on the side. So we do have that individual focus on individual voids, but as well as a more strategic overview. As Councillor Edgington said, it's not just about new baths and basins, but it's total rewires. Boilers are coming to the end of their useful life. So investment in the stock is not going to produce a quick win, but it will certainly feed through into the voids process ultimately. We do, and we did have plans to get into more properties. Obviously, that's been stalled a few times by the obvious. People are very reluctant to let us in at the moment, and for the protection of our staff, we're only doing essential visits as well. But it is important that we get into more properties during the lifetime of the tenancy. There is neglect, there is abuse, and there is also people that are struggling to maintain you know, household standards, cleaning routines, and that sort of thing as well. So that, in terms of prevention, if you like, or assisting with the quality of voids when they come through, is a big piece of our work as well, and shouldn't really be underestimated.
Thank you, Rod. That's most helpful. Councillor Gardner, you've been very patient. Please go ahead.
Yeah, I've got a few questions here, some that you've already answered, which is great. The report was really good. I mean, I find that tenants have got very high expectations in terms of the state of the property when they're allocated it. And then I've had people ring me up saying they've been to it, oh, we can't go there because it hasn't got this and it hasn't got that. Do you find that? Also, in terms of what do you do in terms of bog standard decorating and flooring? You know, when you go, I'm not talking about houses where hoarders have been, and that's heavy duty. And also, do incoming tenants, we used to do a thing, we would give them finances so they could decorate their own properties, things like that. And also, this is just a really stupid. A lot of tenants moan that they haven't got flooring when they go into properties, because sometimes it could be a concrete floor. Is there any way that you can work with some of the developers in the borough? I mean, I've done it. Trust me, I managed to get somebody's house fully carpeted, because there are lots of great big developments going on that are fully carpeted. They've got all the what's, you know, the top of the range stuff. But I just asked somebody if they could help doing carpeting somebody's house for me, and they did it from top to bottom with literally, they said they're offcuts. I've never seen offcuts like that apart from in a carpet warehouse. But I just wonder if there are things like that we can do, or point incoming tenants in the direction. Things like that.
Thank you, Janet. Can you help there, Rob, please?
Yeah, thank you for that. In terms of the standard, in the report, I think we made reference to the minimum lettable standard. So there is a threshold in terms of what the council do when they go into an empty property. In terms of decorating, we don't redecorate. Under conditions of tenancy, the decorative standard is the tenant's responsibility. There will be exceptions to that. You know, we've had properties left, as you can imagine, with offensive graffiti and images up on walls, that sort of thing. So we will decorate in those circumstances. Floor coverings, generally bathrooms, WCs, kitchens, and that we will provide a floor covering, but not what you would call carpets to circulation areas or living rooms or bedrooms. The exception to that is our short life property. We've got a relatively small number of properties that we make available on a temporary basis for homeless households. And we do have a slightly higher standard there in terms of providing basic, and I do mean a very basic carpet and white goods for homeless households as part of assisting with accommodation needs there. But generally, support is available. Melissa can probably help a little bit more in terms of some of the support, but one of my teams, Welfare Reform and Tenancy Support Team, are very, very successful in terms of obtaining grants, whether that's through DWP, local charities, Fastenage Trust and so on. And as part of their resettlement work, certainly for those households who really are up against it, a fair amount can be provided at relatively short notice sometimes. But you've also got some roots in as well, Melissa, haven't you, in terms of support?
Yes, yeah, we make sure that every single person that we sign up has a support assessment along with what sort of items they might need, such as the referrals for flooring and white goods. We also are able to offer vouchers for second-hand furniture through Trinity for anybody that might not have anything to move in with. And so we try to make sure we put lots of things in place so that when people do first get their tenancy, that everything is set up for them if they need that support.
Thank you very much, Melissa. That's helpful. I can't see anyone else indicating. That being the case, I'm going to really will wind up by saying thank you for such a very thorough report, very comprehensive, good comprehensive answers too, Rod and Melissa. That's most helpful. It's good to know how we're looking to make the very best use of our council stock and some of the innovative things we're trying to do along the way. And I think that's it. There's nothing else that I want to add. So I think if no one else has anything further to add on this, I think we'll move on, if that's okay. No one else is raising any hands or fists, so let's move on. Thank you very much.
Thank you.
So move on to the next item, which is the forward plan. Bear with me a moment. So I think we obviously take this as a regular agenda item. I've just got a couple of things to say about this personally this evening. The first is that under our new leadership, the intention will be that the forward plan in the future will take a much more detailed and longer term look at what's coming forward to enable us on committee and members generally to have more input, which I think is very much to be welcomed. Quite often it does look as if we look at things a little late in the day sometimes. Good to look at stuff at the more of the formative stage if we possibly can. So I think that's a positive to share with you this evening. The only other thing I'll say about the forward plan is the item that's coming before Cabinet tomorrow, the Public Health Integrated Services report. That's an interesting one. I've been watching that come to fruition in my sort of dying days as a Cabinet member, and it's an area of huge opportunity for us and challenge at the same time in terms of the amount of money that's being spent on those public health contracts. Real opportunity to shape services in a way that works for our residents. So I'm looking forward to sort of getting into the detail in that as it rolls out. So I'll just put down a marker at this stage really on that. That was all that I wanted to say, and indeed to the forward plan generally. Are there any other comments on the forward plan? There appear not to be. So with everyone's agreement, we will move on from the forward plan, if that's agreed. And the final point is our work programme. So again, we can see what's coming forward. I did wonder about sort of how we come to a view on the sort of things we look at in the future, and that's something that I'll be pleased to discuss moving forward. But we do have a bit of a scorecard, which highlight service areas within our remit that suggest areas that are worth looking at based on various measures. So that's something that we can share perhaps at our next meeting. I've nothing further to add on that, to be honest, at this stage. Any further comments on the work programme? There appear not to be. So I think with that, that pretty much brings the meeting to a close. I'd like to thank everyone for their contributions this evening, members and officers. I think we've had a very constructive meeting, and hopefully we can carry on in that vein moving forward. So no one's indicating, so thank you very much indeed. I think we'll leave it there. Thank you. Goodbye.
Thank you, Chairman. Can I just ask all members? No, it's okay. I was just going to ask everybody to remain on mute just while we end the YouTube stream. Thank you very much.